When I was creating this course, I put some thought into how you might access this, navigate through the course, and gain the most value from it. And I wanted to share just a few of those insights with you. There is a natural progression to the course, starting from the initial phases of thinking about surgery, getting through the hospital phase of things, and then on to recovery. I completely understand that entry points differ. Maybe you're already in the hospital phase, or you're a loved one or a friend or family member who is watching this just to gain some insight on what's going on inside the mind of the person who underwent open heart surgery. And also there's an extra section with photos and videos. More on that in a minute. This is a simple overview of the course. Obviously, you, the patient, is at the center of this, and it's going to start with the preparation, progress on to the in-hospital and surgery phase, including discharge, and then on to recovery at home. There are several sections that are downloadable, and these have checklists. And my goal in creating these was to save time and avoid stress, and to really try to prevent missing things. There are a lot of simple things that are overlooked in the stress and the commotion that goes on when someone's told that they need open heart surgery, a valve replaced, or an aneurysm repaired. It's very stressful. It was for me and my family members, and as a healthcare professional, I'm used to dealing with this, and I can only imagine what it's like for those who are facing this for the very first time and have very little knowledge about this topic. There is a section of photos and videos, and I understand that this may not be for everyone. Certain family members and friends of mine did not want to see anything that had to do with my hospitalization. They didn't want to FaceTime. They were fine with phone calls, but they wanted to sort of turn a blind eye to what went on during open heart surgery and the recovery phase. And I understand this. It's probably a sense of self-preservation or avoidance, but unfortunately the reality is that many people suffer from heart disease, and open heart surgery has become very commonplace. Certainly if you have questions, you can post those in the student forum. I understand that some of it may be sensitive and you don't feel comfortable sharing it. And you can certainly email me at mitchell@mitchellmd.com, and I'd be happy to answer your question. You can also reach out to me on Twitter or Facebook and send me a private message, as you can see there, and I'd be happy to engage with you. There are those of you that really have some unique needs and want an individualized approach. If you're interested in scheduling a private session to talk about some of the issues that you might be facing, get some further insight on your unique situation, I'd be happy to do so. Just send me an email at mitchell@mitchellmd.com, as on the previous slide, and we can talk about the specifics of setting that up. I show this slide not to intimidate or scare you away, but this is more of a in-depth overview of the content of the course. My point in sharing this is that there are a number of arrows that intersect with different sections throughout the graph, the map that you can see here. And the point being is that there are a variety of techniques, concepts, and mindsets that will play a huge role not only in approaching surgery, getting through the hospital phase, but also in recovery and ensuring the best possible outcome. Just to note, the photos were big stock or death to stock photo, and these were Creative Commons or purchased images that I purchased for the specific purpose of creating this course.